Now, with more than 2,000 cases of monkeypox reported in England, most of them here in London, a group of MPs is calling on the government to speed up its monkeypox vaccination programme. The government says it's bought 100,000 additional doses and that the NHS is contacting those eligible for them. Well, to discuss that and answer some of your questions, we're joined by London's Public Health Chief, Professor Kevin Fenton. Good to have you with us, Professor Fenton. We understand the government says that the NHS is contacting those eligible for the vaccine. Can you tell us who is eligible and who is most at risk?
So at the moment, we know that most of the cases are being seen in men, and of that, the vast majority are gay, bisexual, and other men who have sex with men. But we also know that within that group, there are particular risk factors, such as having multiple sexual partners in the past 3 months, having been recently diagnosed with a sexually transmitted infection, or participating in sex in high-risk venues, for example, saunas. So these are some of the risk factors that we're looking at. And clinics are contacting gay men who fulfill these criteria and inviting them in to get their vaccine.
And we have seen the queues, outside one London hospital at the weekend. And many people are telling us, look, we do want to have the monkeypox vaccine, but they're struggling with a lack of information. So can you tell people tonight, if they want to have the monkeypox vaccine, what should they do?
Well, the first thing is that the NHS now has more vaccines, and they're going through the process of contacting the patients who are at high risk and who are eligible for the vaccine. So if you have been contacted to get your vaccine, simply call the clinic, make an appointment, and arrange to have your vaccine. If you haven't been contacted by a clinic at this stage, don't worry, you will be able to get the vaccine in due course. It's just that we need to prioritize the vaccine for gay men who are at the highest risk at this time.
Is there a shortage of vaccines? Because obviously London is a priority given that most of the cases are here.
Well, the vast majority of the vaccine which is available is in fact being distributed to clinics in London because we remain the epicenter of the outbreak of monkeypox in the UK. But globally, there is a shortage of the vaccine, and it's just fantastic that we've been able to secure an additional 100,000 doses of the vaccine, which will be available throughout August and going into September. That's way more than many other countries have been able to procure. And so we're ahead of the game, but the real focus now is ensuring that we get the vaccine into the arms of those who are at highest risk to help to contain the spread of infection.
OK, now the vaccine, as you said, is all about preventing transmission. Let's just hear a question that's come in.
So I just want to ask how transmittable it is compared to, for example, COVID, because I know it's transmitted through touch and skin, and I just wanted to know, is it as easy to get as COVID is?
It definitely isn't as easy to get as COVID is. COVID, as you know, is transmitted through aerosol transmission, which is a much higher likelihood of it being transmitted through respiratory through respiratory means. Whereas for the monkeypox, you really do require close physical contact, such as touching infected lesions on another person, being in contact with contaminated bed linen, towels, and clothing for the virus to transmit. So the vast majority of infections are being transmitted through this close physical contact.
And how effective is the vaccine in preventing transmission in percentage terms? Or do you need more than one dose? Because you've already talked about, a shortage of supply.
Yes, so the vaccine that we're using is in fact a smallpox vaccine, and we know that the smallpox vaccine is also effective against the monkeypox virus, and it does confer protection. The regime is a 2-dose regime, and so we are prioritizing getting everybody their first dose because we know that that provides significant protection against monkeypox infection. And then in time, as stocks of vaccine become available, we'll progress to delivering a second dose of vaccine. But at the moment, the priority is getting as many of the first doses in as many arms as possible.
And Professor Fenton, you talked about the smallpox vaccine. Does that mean that there will be some people in the population who may have, way in the past, when smallpox vaccines were being given out, be already protected?
That may well be the case. Generally, in the UK population, that would refer to people over 45, over 50, but that can't be relied upon because even at that age group and above, not everyone would have received the vaccine at that time. So what we're saying is if you are at high risk and you are contacted by your GUM clinic, your sexual health service to get your vaccine, please take it up because we know that is going to be one of the effective tools we have to help to control spread.
OK, so the overriding message is wait to be contacted, but there may well be people saying, actually, I'd quite like to have the vaccine, and that's not an offer for them unless they go to a walk-in. Is that right?
Unless they go to a walk-in, at which point they will be assessed based on their risk as to whether they're eligible or not to get the vaccine.
Okay.
And of course, we'll be able to administer it at that time.
OK. For now, Professor Kevin Fenton, many thanks indeed for joining us this evening. We appreciate your time.